At Adventist Health, our mission statement's only 9 words long: living God's love by inspiring health, wholeness, and hope. When I think about what I'm called to do, or what we're called to do as an organization, the word inspire jumps out at me in our mission statement. How can we inspire others to be empathic? And as we consider our mission, specifically living God's love, it was done one by one. And empathy is best shown one by one. Again, we meet people where they are and how they are, and just listen.
One of the most important moments that stands out to me to share empathy and my experiences with it would be the Paradise Fire. I worked with the recruiting team during that event, and we met with hundreds and hundreds of victims that went through the loss of their home, the loss of family members. Listening to their stories was very difficult, but I believe that if you make eye contact and you listen to everything that they say, you may not be able to fix everything that they've gone through or lost, but at least they know that you're there. A lot of the stories were the same stories from hundreds of different people. You heard it 100 times, but it didn't make it any easier to hear. And I think if that meant you cried with them, you cried with them. If that meant that you sat there and held their hand, you hold their hand. So I appreciate everyone that shared their story with me. I cherish every moment I shared with every individual.
Our hospital is filled with empathy, and I think the patients needs it, because look at the position they're in right now. And they're in a compromising position where they may just want to share something. And we have to be ready for that at the drop of a dime. We say patients, but it can be a patient family member as well. It can be your own associate that just needs someone to listen to their side and someone to feel their pain. So I think it's so important that we display empathy 24/7, not only inside the hospital, even outside the hospital. So when we get inside the hospital, it'll be easy to display empathy.
Empathy to me is a connection between people, being able to sit with them in their dark moments, even if you've never experienced what they're going through before. Most of the people that work here have never had cancer or had to go through treatment. So for them to be empathetic that way is huge. I don't know that it's something you can train. I think it's just something that is them. And I've said all along that the people that work at the Cancer Center were put on earth for that reason. And they're there because they're amazing.
Empathy is important for the patient. It's when they know that you care about what happens to them. It actually gives them a feeling of trust as a patient, that you're not just another number. You're not the surgery patient. You're not the heart cath patient. You're not the broken leg in bed 2. That you are Mr. Johnson, and you have meaning to that person.
I got a text on my phone that was from one of my coworkers in the trauma department that said, "We have a 13-year-old hit by a vehicle coming in." He had arrived just prior to my arrival to the emergency department, and I've worked with these people long enough that I know when it's bad and when it's not bad. And then this one was bad. So we worked on this young man for a while. You start seeing people's reactions, and one of our charge nurses, her significant other was a bystander for this young man and attempted to help him. And so she was having a really hard time. She was also one of the primary nurses that was taking care of him. So you're dealing with all of these things, trying to make sure everyone's okay, but your ultimate goal is to help the patient. Family started to arrive, and we knew he was very critical. So I informed the family what was going on. I was very honest with them. I took the doctor down there with us, and we talked to them. So we ultimately flew him out down to Sacramento. Just because of his age and his injuries, we needed to get him to a higher level of care. But this one was rough. This one was hard for us. And so as days went on, we started to tell that people were really struggling with his, this particular young man. We found out that another nurse that works at our hospital was also a bystander that had stopped and attempted CPR on him before anybody else had arrived. And she was having a hard time. She told me multiple times when I would run into her and hit the hallways, Jen, I don't know how you guys do what you do. She goes, I couldn't do it. And I said, well, you actually did something a lot of people can do. You stopped and you tried to help that young man when nobody else did. I just get to be the manager, but there's a great group of nurses and doctors and techs and x-ray and lab. I mean, they do the hands-on care, and I'm just proud to be part of this team.
I actually spent a lot of time as a chaplain spending time with patients, but I was actually a patient myself. As an avid cyclist and mountain biker, I recall crashing and needing surgery. And I remember when I was at the hospital that I was gonna need 12 plates, screws. And I remember the point up to being in the OR where they were gonna do surgery, and the anesthesiologist looks at me and she says, hey, this is our chaplain. He's always here for us. Let's be here for him. And then she reached her hand out, and I remember her just grabbing my hand, and she said, I'm gonna pray with you. And so I remember the entire team pausing before surgery and praying for me. And what I loved about that is that she acknowledged me as being a part of the family, the work family. I love that she acknowledged what was meaningful to me. I'm constantly giving myself to patients through prayer, through hearing their story. But at that point in time, I was the patient and I needed to be reached. And so that was the last thing that I remember. And I remember as she grabbed my hand, I maybe remember a few words, but then I woke up some 4 or 5 hours later. And that's when I realized that I love working for Adventist Health, because truly our mission is connecting with patients in a way that's very significant and meaningful. And I'm proud to be a part of a place that is committed to that mission.
In the end, what really matters is our connections with our patients, with our coworkers, with our friends, with our family. That's what really truly matters. It's what brings about humanity in our work and in our world. And that's what makes our lives feel alive. That's really what it's all about.
Show us how you hold the thing. Nice.
Now you need to model because there you go. Perfect. That's
Perfect.
great.
Awesome.
The robot.
Got me right, yes, sir.
Welcome to the Ride Out Lounge. I'm Steve Hammerstrom, your host.